Now, management of the Tamale Teaching Hospital has taken steps to address the water shortage at the only referral hospital in the northern region. The current situation, which has patients and their relatives buying water from outside the facility for daily use, is expected to be resolved in the coming months. Our northern regional correspondent, Shawana Yusuf, reports.
Relatives of patients at the Tamale Teaching Hospital, the primary referral hospital serving the northern, Savannah, Upper East and Upper West regions, as well as neighboring countries, are currently battling a water shortage due to the facility's inadequate storage capacity. The situation is so severe that patients' relatives have to buy buckets of water for their daily needs, and doctors and nurses struggle with a limited supply, hindering service delivery and the country's quest to achieve the SDGs on health, water and sanitation. The Chief Executive Officer of the Tamale Teaching Hospital, Dr. Atiku Adam, speaking at the Tamale Metropolitan Assembly, outlines the impact of the water shortage on healthcare delivery.
Water, imagine running a hospital without water. You come to the hospital in the morning, nurses want to wash their hands after passing a line or doing a procedure. There is no water for them to wash their hands. You want to go to theater, you want to sterilize your equipment, there is no water. You go to Dalong, sometimes even the main pumping station is locked. So daily, our water tanker goes to the main treatment plants to fetch water. Can you imagine a big facility like this? Every day you have to go up and down like that, trying to fetch water for the whole facility. So water is number one problem for the hospital. We have three main problems. Water is one. If we are able to solve the water problem of the hospital, we will solve a lot of problems of the hospital.
The hospital's underground water system has been non-operational for over 4 years due to a lack of funding for renovation. According to Kutuba Tudo, Deputy Director of General Services at the Tamale Teaching Hospital, the 419,000 cedis rehabilitation of the storage facility, partly funded by the Finance Minister, is progressing steadily with 60% of the work completed. He explained the project dynamics to ChannelOne TV in an interview.
Management did was that the first 200,000 that the Finance Minister gave was released to Ghana Water Company. The assessment, the last update was done about a year ago, and the total cost came to about 419,000. But management have also added 100,000. So far we paid not less than 300,000 to the Ghana Water Company Limited. And the remaining, we are expecting that by the time that the works are completed, the Finance Minister would have given us maybe the next tranche, or management and the board would have mobilized additional funds to be able to pay. Additional assessment on the project also amounted to about 50,000, and then management is looking at how they're going to get the funding to complete. This additional works will cover additional inspection chambers to ensure easy access to the tanks, and also to provide new ladders to replace the old ones. At the time we were doing the assessment 4 years back, they were still in good shape, but for now they are rusted, and then we have to take them out and replace them, so that as and when we have to do cleaning in the tank, we can have access. The ladders will be attached, and then other civil works that were also considered.
So that pushes the entire cost to
about 450,000.
Mr. Tido revealed that a total of 300,000 cedis has been paid for the contract to commence, with management contributing 100,000 cedis in addition to the 200,000 cedis donated by Finance Minister Dr. Mohammed Amin Adam for the water storage project. He is meanwhile hopeful that the remaining funds needed to complete the project would be secured soon, with an appeal to the Finance Minister to help with the remaining 200,000 cedis of the total 400,000 cedis promised to restore the hospital's abandoned underground water storage.
Currently, what management is doing about the water situation is to look at storage. We don't get flow all the time. We normally get flow for 3 days in a week. But we realized that our storage tank that we are having currently is just 500 cubic meter, which can just meet our demand for 2 days or 2.5 days. So what management decided to revive the old tanks that used to be used by the hospital before the current tank was constructed as part of the expansion and rehabilitation of the hospital phase 1. The old tanks are still there, but the lines were decommissioned at the time of the project. So what management is doing is that we engage Ghana Water Company to, they are experts in when it comes to water. And so we engage them to revive the 2 tanks. Now what they are expected to do is to connect water into the tanks, feed the tanks, and also ensure that the water can be distributed. We have 3 storage tanks. One is 320 cubic meter. The second one is 75 cubic meter, and the third tank is 108 cubic meter.
Percentage-wise, how far have the work gone and when are they estimated to finish?
Percentage-wise, they have done over 60%. They are expected to complete their works by the close of this month.
With the water expansion projects at the Tamale Teaching Hospital progressing steadily with about 60% completion rate, management of the facility is hopeful that the projects would end as soon as possible to alleviate the burden on patients and patient relatives as well as medical staff at the facility. For Channel One News, my name is Shawana Yusuf, reporting from Tamale in the Northern Region.